Hi, everybody. I'm here with our first Blueberry Pediatrics Roundtable, where we have several of our pediatricians ready to weigh in on a very interesting topic and timely based on what's going on in our country right now. We are going to talk about measles. And why is this relevant right now? Well, in my inbox this morning was a healthcare advisory about the measles outbreak in America. And as of today, we are hearing reports of Texas having 124 cases. Actually, that's of February 25th. There might be different numbers now. Only 5 of those were vaccinated. 18 patients have been hospitalized, and there has been 1 death. There has been a pediatric child's death. In New Mexico, they're reporting an outbreak as well. As of February 25th, they have 9 cases identified. Canada also, 44 cases in all of 2025 so far. 31 in Ontario, 13 in Quebec. 33 of these people were unvaccinated or had unknown vaccination status. 4 of those were hospitalized. New Jersey reported 3 cases of measles among unvaccinated people. And then in New York, I know they're discussing 2 cases at the moment, and this is pretty up to date as of today. All right, so we are going to go through the topic. I know it's of interest to a lot of parents who are concerned and do have questions. We've had a lot of incoming questions coming in from all of our patients. So I'm going to start with everyone just saying who they are and say hi quickly, and then we will get to it. Kristen, you want to start?
Sure. I'm Kristen Borchetta. I'm a pediatrician in Florida.
Monica?
I'm Monica Daver, and I'm a pediatrician in Denver, Colorado.
Jeff?
Hi, and I'm Jessica Madden. I'm a pediatrician and neonatologist in Ohio.
Thank you. All right, so let's dive in. Let's talk about the presentation. I know a lot of people get nervous about it, so they're like, can my kid have it? So what are the most common things that we're looking for? Does anyone want to jump in?
I think the one thing we all think of, and we have to back up to that, we have all trained in practice where we don't see this regularly. But when I think of measles just in general, I think of a rash. I picture a child with like red cheeks and a rash that's just all over their whole body and who looks pretty sick to me overall.
Yeah. So classically, you'll learn like what we call the 3 C's. So cough, conjunctivitis, and coryza. I don't think anybody even uses the term coryza for anything else anymore. If you hear it, it's measles every time or in the context of measles. But conjunctivitis is basically pink eye. And so that's sort of like the prodrome of everything. And then it's this rash that looks sort of like rough and pink. And the classic teaching is that it's as if somebody poured the rash onto the child. So starting at the hairline and then moving down slowly to the rest of the body. And it usually involves like the entire body and doesn't really have any areas that are spared. It's a pretty dense, kind of bumpy red and pink rash.
I think one of the things that are hard to do is differentiate it from another type of virus. Is there something that you would say sets this apart necessarily?
Well, you can also look in their mouth. So Koplik spots are another finding, which are like these little kind of white and pink bumps. They almost look like a miniature cold sore on the inside of the cheeks. They're not tender or painful though, the way that you'd expect a cold sore to be. And they're not, I think they are usually present. I don't think that there's any cases of measles where they're not there. So that's the other part of the body that I like to tell people to check is the inside of the mouth.
Interestingly, only about 70% of cases have Koplik spots, so you can see kids who don't have them. And I think for the parents, it's really important to note that coryza is runny nose. So those first few days with the cough and runny nose and cold symptoms, fever are pretty nonspecific until the rash comes in.
Mm-hmm.
Right, which I think is what makes it so dangerous. It's such a contagious disease, and then you don't know it's measles necessarily until the rash is more telltale of the diagnosis, and you're already contagious. The person is already contagious before that and could potentially pass it along.
Yeah, we should also talk about that. So the way that measles is spread is actually pretty unique. So like if you were to think about influenza or other viral illnesses, the way that those things are spread is that a respiratory droplet has to be spread. So somebody that's sick would have to like spit on something that then someone else becomes in contact with and then somehow gets into their mucous membranes, their eyes, their nose, or their mouth. But measles is actually airborne spread. So what that means is, for example, if there's a kid sitting in the waiting room at the doctor's office, simply breathing, they're actually infecting or there's an exposure to everybody that was also just sitting around in the room basically doing nothing. So a normal mask doesn't help. You need a specific mask called an N95. So it's just a super contagious illness, and it's a little bit different in that regard than normal respiratory viruses.
And it's one of the most contagious diseases of infectious diseases of known that we know, affecting 9 out of 10 people exposed. That's a wild number.
Yeah.
And this is why effort was put into creating a vaccine for it, because it just rips through communities like crazy.
And even worse is that the particles can stay in the air for, I think it's like 2 hours after the kid leaves. So even when the kid's not there, it's still contagious to the people who are walking through.
Horrible.
The other thing that really just worries me about it too is this whole idea of you're contagious for about 4 days before that classic rash. So again, like we're talking about, your child may seem like they have just some other viral illness, a flu, a really bad cold with fever. So the contagious period is 4 days before the rash. And then once the rash starts, it's for 4 days after that too. So there's a window of over a week that everybody's contagious.
Yeah. Well, should we get into like the thoughts behind why this is worth vaccinating your kids for? And do we want to talk about that? I mean, because I think plenty of people out there would say like, well, it's not a big deal. Like I can expose my kid to measles. So what if they get it? So what if they're exposed to it? Why is that such a big deal? And I don't know if Lindsey, you have some of the stats on that. I mean, you already shared that there have been deaths from this in this current outbreak, but I think just like the post-infectious autoimmune complications are worth mentioning too. So I don't know if we want to get into
well, let's first go through the vaccine and its effectiveness. I think that's a good way to give out information about it. So it's the measles vaccine is a part of the MMR vaccines, measles, mumps, rubella. And it's usually given at 12 months of age and then again at 4 to 6 years of age. There are exceptions to this. We'll go into that in a minute, because at a time like this, it's definitely given a little earlier, because the first dose protects is 93% effective against getting the measles virus. And then at the second one after that's given is 97% effective. So the first is great, second even better. And so it's quite effective at what it's doing. And so then what I think a lot of people depend on is called herd immunity, which is like, well, everyone around us is vaccinated. Why do I need to do it? But this is exactly why we're seeing outbreaks right now, because then if a lot of people are not vaccinating because it's so contagious, anyone who's unvaccinated is quite susceptible to it and will get it and pass it on and is not participating in the herd immunity and just really
putting others at risk.
Difficulty, yes, we're putting others at risk. Thank you.
I've heard a lot of conversations recently too, just about herd immunity. Well, there's always been measles outbreaks. So if we go back to 15 years, every year in the U.S. there's measles outbreaks. That's true, but this is the point at which we're losing herd immunity is right now. So all of those previous years, those measles outbreaks were pretty well contained because vaccination rates were so high otherwise. And now we're at this tipping point of that's no longer going to be the case. I don't know if that makes sense or not, but that's why this just seems a lot different than the past.
Okay, so we've had some parents who have young children who are younger than that usual 12 months of age when they get the first dose, asking if they could get it early. So let's discuss that a little bit.
Okay.
Monica, you want to update us?
Yeah, for sure. So generally speaking, the MMR schedule is to give a dose at 12 months at the well-child check, and then to give the second dose at 4 years of age. You can give these early. It's important to note that for kids that are less than 12 months, the earliest we can do the first dose is 6 months of age. And if you give it at 6 months, you're still going to need to go ahead and do the 12-month dose and the 4-year dose. And the reason is that for the first year of life, there are thought to be circulating maternal antibodies that somehow interact with the vaccine and mean that the immunity that you get from it is a little bit less. It's still worth doing. It's just that the lifelong efficacy of the vaccine is not thought to be as good if that first dose is given before a year of age. So what we recommend is go ahead and do it. I actually was telling everybody I took my 3-year-old in today to get his second dose of this early, but you will very likely still be doing the rest of the series. And it's worth doing, especially in times like this, because again, it's such a contagious disease. But just kind of know maybe going into it that you're going to have to do the full series anyway. But the immunity is great. I mean, some vaccines don't confer, such great efficacy, but it is a live vaccine, I believe. And so, the immunity is really good and tends to be lifelong, which is why we never see measles. Because, even without everybody having the vaccine on board at this point, we're still not really seeing it because those that are immunized really are immune to it, which is cool.
And so if someone hasn't had a vaccine before, there's a catch-up schedule. And that just requires, as long as they're over a year of age, they could do the first vaccine at any time. And then the second vaccine, correct me if I'm wrong, but it could be given as soon as 28 days after.
Yeah, that's right.
Yes, that's correct.
That's
yeah.
right. And another question I think we've gotten a lot is like, if my kid got their vaccines on time, should I get a third dose? And the recommendation is no, because it works so well. There's really no need to give extra vaccines if they were already on schedule.
Yeah, and I was actually just going to segue into, I've had a lot of parents of some of my patients ask me, well, what about me? I know that I, as an adult, was vaccinated during childhood. Do I now have to get a booster dose? And we can talk about this a little. My understanding is, for the most part, no, that if you can confirm that you've had 2 MMR vaccines during early childhood, that we should have lifelong immunity. There are exceptions to that, but as a whole, as long as you've had 2, you should be okay.
There's a year cutoff too for adults. If you got it, I think before 1980, then you probably didn't get 2 doses. So I think they are recommending to consider a second dose for older adults that probably didn't get both. But
yeah, that's true. I think they initiated the 2-dose series, I think it was 1989 or 87, something like that.
Yeah.
You can always get your titers drawn too. In med school,
Right.
I remember they made everybody get their titers drawn for everything. And I think I needed 3 extra doses of Hep B before it finally stuck. But you could always have your doctor do that too if you're concerned, or if for whatever reason you're not sure. It's an easy blood test, and it's a good way to find out.
All right. So in terms of what we do, should we be concerned that a child comes in and was exposed to measles or could have it based on symptoms? Let's walk through that process.
Yeah, so I think what we're talking about is what's called post-exposure prophylaxis, or PEP. So what do we do to make sure that someone exposed doesn't contract measles? And there are a few things. If you're vaccinated, then really nothing is needed except monitoring. But if not fully vaccinated, especially if they're young kids, we have a couple of options. One is to give the MMR vaccine within 72 hours of the initial exposure if the kid is old enough, so 6 months or over. The other option that can be done at any age or up to 6 days later from the exposure is to give something called immunoglobulin, which is basically antibodies to measles that you can give, and then you can get vaccinated later if necessary.
And immunoglobulin is given through an IV, so it's like that.
Or I think there's also an injection.
Or IM, which is intramuscular, which is a shot.
Right.
So.
Okay, great. And then if they come in for testing, it's a swab, either in the nose or the mouth.
Yeah, and they also can test serum too, and the blood too. And that's something I've had a couple patients' families ask about, well, how do we do this? Where do we go for testing? And it really does. The first thing I would say is, if your child has a primary care pediatrician, call their office, tell them about the exposure, your concerns, so that a safe method can be set up for you to be able to go in and get tested without exposing anybody else in the office. This is something also that can be done at urgent cares or emergency rooms. However, you would also want to call ahead of time too. And then local public health departments, depending on what county you live in, can also be a really good resource and another way to facilitate testing for your children.
All right, so why are we so worried about this? How bad is it if somebody contracts measles? What does it really cause? We gave the symptoms, but what would a course for a child look like normally? Why are we so hung up on that? We should be fighting this.
It's really funny because I feel like none of us have that much experience with this because.
It's true. Well, let's pause. I'm looking it up too, but we'll pause here.
I can tell you because I wrote some
that's
information.
But take it away, because that's the thing is that I think that's what people should worry about right now is that the doctors that are in practice don't know what to do. This is similar to when COVID first became a thing that we didn't know. I mean, of course there's protocols and there's evidence from what happened before, but no one is really experienced in this right now. And to me, that's scary to think about that.
It is
scary.
Yeah. I think that's so important because everybody always says, "Oh, it's just a virus." Like, why this virus? And yeah, most kids who get measles probably will just feel really terrible, have a week of feeling miserable and having a terrible rash. But one in
And fever.
20 and fever, right?
Yeah.
But one out of every 20 people who gets measles will get pneumonia. One out of every 1,000 who get measles can get encephalitis, which is inflammation around the brain that can lead to deafness, hearing loss, permanent disability, seizure disorders, and then
And when
anywhere
you're
between.
talking about that with children, it's also developmental delays and really restructuring of the brain in a way that like kids are unable to grow up hitting the milestones when they're supposed to and how they're supposed to, which is a terrible thing.
It's
Yeah,
huge.
you
And
right.
the other scary thing about so you're talking about the subacute sclerosing panencephalitis that can follow measles. It can happen 2 years later. So it's 2 years after
It's
the
actually
primary
7 to 10.
7 to 10 on average, but as early as 2.
Yeah,
So
as
that's
early as 2.
horrifying. And this is a degenerative neurologic disease with no cure. So this
And
is
it's actually most common and affects children and young adults who had measles at less than 2 years old. And so why, as pediatricians, we're so extra crazy about it is because a lot of these, most of the complications happen for the people who are at risk for them, which include kids under 5 years old and those who are immunocompromised.
Right. And then 1 to 3 kids who get measles, out of every 1,000 kids who get measles, 1 to 3 of them can die. I mean, it's really serious. And I think those are pretty staggering numbers. Usually we hear like 1 in 1,000,000 or 1 in hundreds of thousands for complications, but 3 kids in every 1,000, I mean, that's a pretty terrifying
yeah, it's
number.
horrible.
Right. And so if a child has measles and they're sick enough to get admitted to the hospital and they develop other secondary infections from their measles causing them to be so sick, like they are dying from measles. So a lung infection, pneumonia in the lungs, that's a measles, unfortunately, fatality.
Yeah. And I think why you're bringing this up is because what we've heard amongst communities during this outbreak and as doctors, what upsets us so much is that people are saying, well, the complication isn't measles. It was something else. It was like pneumonia or bad ear infection. But the root cause of that is measles. It's not that there's another bacteria or virus going on with causing ear infection or pneumonia. It's actually measles doing it.
Right.
All right. All right, I'm going to bring this back around because we don't want to make this just a terrifying talk where we're just scaring everybody about all the bad things. In general, you heard the numbers I gave in the beginning. The amount of measles cases are relatively still not super high. However, we have to stay diligent. That's why we want to talk about it and bring it to the forefront. That's why all doctors are getting hit in their inboxes from government sources telling us updates, what people are presenting as the detriments to catching measles and what we should be looking out for. As Dr. Monica said before, a lot of us have not seen measles, thank goodness, in our career. So we have to be kept up to date. And I think there's a lot of places that are trying to do that and do a good job. And it's just such a big deal, though. And that's why we're talking about it so much.
Yeah. I think we should talk too about the fact that like when measles was a thing, people were not traveling the way that they are now. I mean, globalization is such a huge thing. People can travel anywhere they want in a day and come back. And that just wasn't the case when measles used to be something that affected people day to day. And I think that's really interesting to consider because I've seen on social media pediatricians who will say like, well, we're not recommending early vaccination because the outbreak is supposed to be in your local community. And that's like what the CDC says. And it's like, well, what does that mean? I mean, I live in Denver where if I go skiing on a weekend, my kid could spend an hour or two at the ski lodge hanging out, and I don't know who's there. Maybe there's people from Texas.
With someone from every state.
Or country.
You just don't know anymore. I think that globalization is such a huge, like it's changed so much. And I don't know if we can really consider like these local outbreaks to be the only criteria for being proactive and, getting these kids immunized early. But that's just my opinion. Maybe people disagree. I don't know.
Mm-hmm. I like that point.
That makes total sense. Yeah.
Anything left to add?
I had a really good question. I mean, I've been fielding a lot of questions just from my personal social network, and it's been really fascinating. But one really good one I got yesterday was, I've heard before that if my child gets an MMR, that there's a potential that then other people in the household, they can get measles from it, and then they can make other people sick from getting the vaccine. And maybe we can talk through this. My understanding is a small percentage of children, as a result of their immune system responding to the vaccine, may break out in a mild measles rash, right? Like it's a vaccine-induced measles in a small percentage, but that's not contagious. They're not going to then infect other people from that. And I was thinking back to so many times my kids have gotten vaccines and they have younger siblings. I've had an infant at home. I never even went through my mind to think about like, oh my gosh, is my baby going to get sick because my older kids went in and got a vaccine today? Mm-hmm. So I just figured if one person asked me that probably other people, are wondering the same thing.
Absolutely.
Yeah, I think
that post-measles vaccine rash is something that more people need to be aware of, that's a possibility, because I think a lot of parents do get nervous and think, oh my God, now my kid has measles, even though it's an expected, pretty normal side effect. So.
Yeah, and a fever.
The vaccine worked. It means that's why this is, it's an immunogenic vaccine that works. And that's why we see probably the most side effects with the measles vaccine out of all the vaccines that exist. This is like one of the more likely ones for us to have a follow-up appointment about something, like whether maybe we should just go through all the side effects of the measles vaccine for people that are wondering. But it's like the funny bump, the big bump, the fever, the rash, things like that, the fatigue, all of that is normal. And it just means that the kid's immune system is actually responding to the trigger that we've given it and doing what we want it to do to create this, this immunity that's going to last for the rest of their life.
And it's short-lived. My kids, 2 out of my 3 kids had a lot of those things. Like, it's not just like a little bump. Sometimes it gets super red. Even that site can get infected within itself, but usually it's just the vaccine reaction and normal goes away. It can be a little uncomfortable for sure. My kids at like 5 to 7 days, 2 of them had fevers. It's like short, one day, wasn't super high, at least for us. They didn't even know that they had a fever. They were fine. It was more me concerned, like, did they have a cold? This is after the vaccine. I didn't know what was going on exactly. And then it went away and they were fine. We had a rash in one kid too.
But hey, they're going to be immunized now. So it worked. It did its job.
Yeah. That was always reassuring for me after vaccines for my kid. I'm like, oh, she has a fever. All right, we're going to stop this. So,
yeah.
All right. Anything else we should add?
I don't think we've talked about the fact that this is a reportable illness. We talked
for the doctor side. Sure. Yeah. Like just as I was able to give everybody the numbers as to what's going on in each state, whenever anybody treating measles will have to report it in because we have to know what's going on in communities. It's very important. Is there anything more to add to that?
I think like for people that are just going to keep their kids home, it is good to just give a call to somebody like your provider or your local health department, just so that people in your community are aware and that you're kind of adding to those community statistics. But that's probably all. I mean, it doesn't mean you need to go anywhere. Certainly.
I always tell parents too, like, please make sure you answer phone numbers that you're not, that you don't know who it is, because the health department is going to call you and they are going to ask you a lot of questions. And it's so important to answer all of them so that we can track.
Yeah. So I guess I was thinking one more thing I was thinking about was, as a parent, finding out that your child does have a case of it, even if it's another measles, another virus. I think this is a situation where it's really important to be upfront and let other people know who have been exposed to you, because that's how we stop the spread. And this is a situation where I think it might be hard to say, hey, I was at a birthday party or I was at Chuck E. Cheese. I found out my child had measles, but these things are going to happen, right? So that's the most important thing, is you have to notify to let people know so that they know to watch their kids and to be on high alert too.
Yeah, I think there's a lot of fatigue after COVID with that sort of thing, but just to really like second that opinion from Dr. Jessica, like it's really important because of all the information we just gave for how it could badly impact kids, to just stop the infectious nature of it. So keeping kids home is super important. All right. Thank you, everybody, for joining us. This was so great. Thank you, doctors. Super informative, super important. I love this little round table. Let's do it again.
Sounds good. Thank you for having us.
Thanks, guys.
Have a great day.
Bye.
Bye.
Thank you all for tuning in to today's episode. Be sure to subscribe to the show for more episodes. And if you love the show, if you haven't already, please be sure to leave us a 5-star review.